Welcome back to the Simplify Senior Transitions podcast, the show where we bring you real conversations, expert insights, and practical tools to help families navigate the journey into senior living and aging in place with more clarity and confidence. I'm your host, Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. As part of the sandwich generation, I know firsthand how overwhelming it can be to juggle work, raise a family, and figure out care for aging parents. And that's why I started this podcast to simplify the process and connect you with trusted voices in the field. Today's guest is a true pioneer in the world of home modifications, Martin Simenc, founder and president of Home Safety Services. Martin started this company over 20 years ago, well before aging in place became a buzzword. And he's been leading the charge in making homes safer, smarter, and more accessible for seniors ever since. From grab bars to whole home remodels, his team has helped thousands of families age safely with dignity and independence. Today, we're exploring the history of home safety, the innovations changing the game, and what you can do to keep your loved ones safer longer. Let's dive in.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
And we're back, everybody. Good morning, Martin. I appreciate you being on the show with me today. How are you?
I'm terrific. Thanks for having me.
You're welcome. So, Martin, let's just jump into this. Take us back. How did the idea for Home Safety Services first come about?
Well, the short answer is that about 30 years ago now, my father had a stroke.
Okay.
And so I made some modifications around the home for him. It really improved his independence, and afterwards realized that, if I weren't there to do so, he probably wouldn't have had those done. And so that started the process of thinking that, well, maybe there's a business here to help others and have it be a really mutually rewarding enterprise. And that's proven to be the case.
Okay, perfect. Now, what were some of the earliest challenges in trying to build a company around senior home modifications?
I'd say the biggest one was just consumer awareness that there were experts out there in this field to help folks do so. Going back 20 years ago now, when we started the business, senior accessibility, home modification was not even a niche category of business at that point. Very little knowledge of it. And so that was probably the biggest challenge. The second biggest challenge was, inertia of the individuals to make any changes in their homes as well. As the older we get, the more set in our ways we tend to get.
Right.
And, so those two challenges were formidable.
Okay. Now, for any of our viewers or listeners that, don't know about your business yet, where are you located and what areas do you service?
Okay. So we service all of Northern California and most of Central California as well. So we're headquartered here in Burlingame, California on the peninsula, right next to SFO. And we've got a great showroom here for customers to come in and experience.
Okay.
But we work on a hub and spoke model. And so we've got depots throughout the state and technicians based throughout the state to enable us to cover, everything from Fresno to Visalia at the south end, up to Redding and Mount Shasta at the north end.
Okay, wow, you cover quite a large territory, so that's good to know. What's changed the most since you launched the business?
Let's see. Well, I think every bit. Because it's been a good run here of 20 years now.
Yeah.
So, I'll go back to the previous question that you asked about consumer awareness and industry awareness. We now have competitors in this space. We now have national players in this space. We now have some appreciation from the healthcare community. So there's a good ROI for investing in prevention.
Okay.
including things like making home modifications. So it's been a pretty dramatic change through the years, and through all of those changes, now there's more funding sources available as well to help folks get these things done.
Okay, now, when did you realize this wasn't just a niche service, but a vital need for so many families?
Well, I think I realized that part right away. The challenge was getting everybody else to recognize that. So to generate the demand and the lead generation,
Yeah.
the openness to have, an expert resource come in and guide and counsel and work with families in this regard. So, the niche and the need has indeed always been there.
Yeah.
But with, the evolving demographics, with the baby boomers
Right.
coming of age and whatnot, need and demand has just been increasing nearly exponentially for the last 10 years or so.
Okay. Now, going to the actual type of work you do in homes, what are the most common modifications families are asking for today?
Well, by far the most common one that they ask for are grab bars in the bathroom.
Okay.
Okay, that's the one when you think of home modifications, the vast majority of folks are going to go to the grab bar. And with good reason, because it's a wonderful solution, super cost effective, super helpful. And now aesthetically, we can have things match the existing decor. And so we don't have to institutionalize homes by providing some of these safety devices. So that by far is kind of the entree or the entry point into the home for consumers in this regard. But from there, it's, it grows throughout the bathroom in terms of assistance around the toilet, seating alternatives in the shower, making access in and out of the shower easier. And then railings and ramps are huge needs for individuals as well.
Okay. Got it. Now, this is a related question, and maybe part of what you said in your last answer might be connected to this question, but I wanted to ask, what's one simple home modification that can drastically reduce fall risks, but most people overlook?
Excellent question. So I guess I would go towards the stair railings as being the under-recognized opportunity for folks, because again, folks know about grab bars now, finally. But the risk of falling on the stairs is, it's the riskiest place in the home. Because not only because of the number of the falls, but the severity of the falls that occur there. So those are often the life-changing hip fracture falls, head injury falls that we really want to prevent. And almost without fail, virtually every home that we encounter doesn't have adequate handrails in place for all of their stairs.
Okay.
They might have the main stairs well equipped, but maybe the stairs off the back porch or between the garage and the house where, folks have the laundry in the garage so often, but those stairs between the house and the garage can't be treacherous, poorly lighted, not the best constructed, and usually without good sturdy handrails on both sides. So I think the most commonly overlooked opportunity is that of stair railings.
Now, how do you assess a home for safety? What does a typical evaluation involve?
Okay. Well, it involves not only the home, but the individual as well, obviously.
Okay.
So we have to really get a sense of the individual's capabilities, abilities, and challenges and history before we go in and assess the home environment. So we want to know if they've had falls, where they've had falls, if they're using an assistive device. Do they use a walker in the home? Do they use a wheelchair at times? Do they use a cane or other support device? Do they have care? Do they have assistance when they're coming and going, or are they independent? So we've, kind of gather that data first, and then take a look at the home environment and assess it based upon their specific conditions. And oftentimes we're dealing with one senior that might have experienced a health issue, and they're recovering from hip fracture or knee replacement or something. But we do have to look at the caregiver as well. How competent is that caregiver? What issues do they have? Um, because the last thing that we want to have happen is, start with one patient and end up with two patients because we have accounted adequately for the caregiver involved as well. So we gather that data and then we walk through and assess the home, and through our experience of helping, we're approaching 50,000 now, but well over 40,000 clients throughout Northern California. We know where in the homes the greatest challenges are. Our guys are really thoroughly trained at assessing the situations and then knowing, what are going to be the solutions, not only for the individual, but for that individual in that individual home configuration. And so it's not a one-size-fits-all solution by any means. It's really customized based upon, the individual's conditions and then the configuration and condition of home as well.
Okay, yeah, I get that. There's a lot of just factors and moving parts that you got to figure out before you figure out what solution to provide, right? Do you ever run into resistance from seniors who don't want to change their home?
Absolutely. Yeah.
Okay.
So, and it's just a standard part of our business to encounter that because folks, as I mentioned earlier, just have some built-in inertia to making any change in their home.
Yeah.
So the one advantage that we have is that we come in as an outside objective expert in the field.
Okay.
So oftentimes, even if an individual has some resistance, and even though the adult children have been saying, hey, dad, or hey, mom, you need these things done, if we come in from an objective perspective, plus great expertise and credentials to back us up, oftentimes they hear us differently than they hear the adult children. And so we might be recommending the exact same things that the adult children have been saying, but they're more receptive to us because of being that outside expert, objective, source for them. So it's a challenge, but we do have to show some assertiveness, demonstrate that we have the expertise, play devil's advocate with them at times to encourage them. But at the end of the day, it's their choice and the family's choice. And obviously we can't force anybody to do anything. But we are going to try to educate them as best we can such that they can make an informed decision.
Okay, got it. Now, I know you've done senior home modifications for thousands and thousands of homes. I know there's a lot of stories here. What's one success story that really stands out to you?
Well, you're right. We do have lots, and they're adding to them every day, which is really rewarding. So personally, for me, one I was involved with personally years ago really sticks with me, and it was actually for a hospice situation.
Okay.
So an individual living locally, the wife called us and said the husband just recently taken a significant downturn, was now in hospice. But his whole life was being outside and enjoying the garden. And she really wanted him to continue to have access to that. And fortunately, they happened to be local, but through use of some technology and using a virtual home assessment, we were able to assess what their needs were. And we were out that next day. It was either that next day or even that later that day, I believe, to actually perform an installation for them because we had all the equipment in stock locally. And we were able to put in about a 30-foot wheelchair ramp that enabled him to, from his porch down to his garden level. And the feedback that we got from her was so appreciative that, oh my gosh, you've just enhanced his quality of life for his remaining time so dramatically and so quickly. She couldn't stop appreciating that. And not surprisingly, several weeks later, she called back and said, he's passed, and we so appreciated the ramp. Yeah. But now I've got another favor to ask. We've got everybody coming to the home over the weekend. How soon can you come out to remove the ramp? Because it's a image that reminds us of his final days instead of his vibrant life. And we were able to, fortunately, again, be able to be out that afternoon, remove the equipment, take it away such that there was no sign that it was ever there. And again, she couldn't stop showing her appreciation to us for what an impact that made to not have the ramp there when the rest of the family came over to pay their respects and celebrate his life. So being able to do a quick turn with a dramatic improvement in accessibility for them was really rewarding. So I love those opportunities to help, even though it was at a sad time in their lives. It was rewarding to be able to bring something positive to them.
Yeah, I like this story. Thanks for sharing that with me. Now, I wanted to segue into questions more so related to aging in place versus moving into a senior living community, assisted living community. In your experience, what types of families benefit most from aging in place solutions?
Well, to me, I'm not an expert in making decision between the two, in all frankness. So it's very much a personal choice.
Okay.
What we want to, I guess, educate folks on is that they do have a choice.
Mm.
You know, some folks are under the perception that, oh, it's a 2-story home. We can't keep mom or dad at home. Well, that's really not the case anymore. Through the use of a stair lift or other devices, we can get folks up and down. We can make a bathroom accessible on the lower level. There's lots of ways to enable folks to keep folks at home such that they have that as an alternative. In terms of then making the decision as to financially what makes most sense, and socially what makes the most sense for the individual, that's really a personal decision that we'll defer on to other folks and experts to assist with. But we just want to really educate the community that, in most cases, it's not cost prohibitive to make the home accessible for an individual to be able to stay there if they so choose to do so.
Okay, I like that. Now, are there signs that a senior home modification isn't the right solution?
Yes, I guess when they're not done properly,
Okay.
as I alluded to, the last thing we want is a well-intended modification to contribute to, an injury, and we end up with multiple patients instead of one patient. So in that regard, we are really careful to only do things that are really in accordance with best practices to make things safer for folks. And really frequently, you might be surprised, Dale, we get asked by folks to do all kinds of things. And we don't feel like it's in accordance with best practice or it could lead to, an unintended consequence. We walk away from that business, and we do it a ton with wheelchair ramps specifically, because folks perceive that, oh, yes, I can have this very short and very steep ramp and I'll be able to help my loved one up and down. And almost on a daily basis, we walk away from work and just say, hey, I'm sorry, the shortest ramp we can provide for you based upon our standards in this situation is X feet of length. And because the last thing we want to do is, have it be unsafe for you. We've walked away from a lot of revenue by doing so, but I feel really good about it. And it's worked out well from us too, because we don't want the liability of doing something that would not be in accordance with best practices as well.
Yeah. Now, how do home mods complement other care services like home health or caregiving?
Fantastic. I love the question because we have the same mission and purpose, and target customers as home health, home care, and we really work in collaboration with both of them. We do not compete with them in any way, shape, or form. On the home health side, that's the medically oriented assistance, by my definition anyways. Those are folks that are making sure that the transition from hospital to home generally goes safely. And what they really want to do is make sure that it's a successful transition and the individual doesn't end up in the hospital. Well, one of the best ways to prevent them from ending them back in the hospital is make sure they don't fall at home. And so making the modifications that will reduce that likelihood of fall and re-injury and rehospitalization is perfectly aligned with their mission and objectives and metrics as well. On the home care side, the modifications that we make are generally loved and appreciated by the home care aides. Because if we have appropriate support in place, whether it's for getting in and out of the house, on and off the toilet, in and out of the shower, it's going to make that caregiver's life so much easier. And a happy caregiver is a happy client, is a happy home care agency.
Right.
But one step further, too, we are providing that additional support for the individual. The home care aide is much less likely to injure themselves lifting and transferring the patient. And so thereby, from a workers' comp perspective, the home care agency loves to have us come in and provide some of those modifications to make it safer for their home care aides as well. So it's very much a complementary relationship, and we value, the many relationships we have across our region with both home health and home care.
That's excellent. Now, I'm now curious, how are seniors even paying for all of this stuff? Are there any state or federal programs that help pay for home modifications?
So I guess I'll just start by, again, trying to dispel the what might be a myth of that, home modifications are unaffordable for a lot of folks. Again, relative to the cost of relocating an individual or adding more home care at times, the cost of home modifications are generally quite modest and quite affordable. That being said, there are tons of programs out there now to assist individuals with paying for home modifications, many more so than existed, 25, 28 years ago, fortunately. So, the biggest and most established is the Veterans Administration.
Okay.
They have a terrifically generous benefit for home modifications. It's been available for many years, but there are other community agencies that get some funding as well. And so through either the VA or community grant funded organizations or through private pay, generally, there is a way to get most of these things accomplished for individuals in need.
Nice. Now, what should families know about insurance or Medi-Cal coverage when it comes to safety retrofitting?
Okay, good. So insurance-wise, traditional Medicare excludes home modifications, unfortunately. So, but Medi-Cal has recently increased their coverage for home modifications. And so Cal recipients can self-refer to their managed care plan to make a request for home modifications. So that's just a recently expanded program and a wonderful benefit that's now available. The other aspect or type of insurance that occasionally has coverage are the long-term care insurance plans. Not every plan has a rider for home modifications, but many of them do. So if your loved one has long-term care insurance, I definitely encourage you to contact them to see if there might be coverage available for home modifications there as well.
Okay. Well, one thing I wanted to ask you was more so about your company. You've been doing this for over 2 decades. What do you think has helped your company stand out? I mean, you're still around, you're thriving,
It's been a journey. But thank you for recognizing. And I think what's stood out for us is a few things. One is adhering to our core principles and core beliefs and not wavering from those. And those are, having expertise in what we do, having tremendous efficiency in what we do, and delivering what we do with great care. So those are the 3 principles and hallmarks that we've stuck to, we use as a filter. And it's really rewarding when we get feedback from our clients.
Right.
Oftentimes they're using those words to describe our service. So that's one aspect that I think has helped. The second aspect that would go to our credibility and our credentials.
Okay.
So we have bent over backwards really to establish ourselves as the most credible, the most professional provider available in the marketplace. And this was really important to us when we were starting the business because there really wasn't an industry. And so we had to do backflips to demonstrate that we're really the experts in this space. So we sought out every designation that there is in the space nationally. The National Home Builders Association has a CAPS designation. Another group has a CAC designation, which requires some studying experience, testing, all of these things, customer referrals. But the really important ones, credibility-wise, that have been extra helpful for us is, as a starting point, being licensed as a general contractor, absolutely essential. But most importantly is being accredited by the Joint Commission.
Okay.
And folks that are outside of the healthcare space might not recognize the importance of accreditation, but anybody within healthcare really does. And accreditation from the Joint Commission specifically holds us to the same patient safety standards as a hospital or a healthcare provider. So we have extremely, extremely rigid and detailed requirements for every business practice that we perform, whether it's client-facing and patient-facing or internal practices. And I'm really proud to say that we just went through our 4th on-site eval and renewal for our Joint Commission accreditation, which is a very detailed audit of everything that we do to make sure that we're up to the same standards as healthcare providers and hospitals. And I'm really proud to say that we came through with flying colors, and so we'll be renewed again for another 3 years, which is great. So I think it's those combinations of things that have given us credibility and ultimately stability and success in the market.
Congratulations. Yeah, you built up such a strong reputation, and you do what you say, you know? What's one lesson you've learned from working directly with seniors and their families?
Good question. Well, in this space specifically, you know, we really have a unique relationship with our clients because we are being brought in oftentimes at a time of personal crisis or health crisis. And very quickly, we have to demonstrate credibility to them and trust and confidence. And so we recognize that. But I guess what I've learned in that process and working with them, that if we listen to them deeply and genuinely and respect them and everyone that's involved, whether it's, you know, the adult child, the spouse, or perhaps, you know, the individual that has the physical challenges. We respect and include all of them, and then we do a good job of educating them as to what their alternatives are. We don't have to sell.
Okay.
Things will take care of themselves. If we've done those front-end things and then we educate them genuinely, just with our best advice, as if we were helping a family member and advising a family member, we have no selling process. We have no closing process. Do those things, educate them, and if it's meant to be, they're going to have it done, and the business will ultimately do fine. And so that's been, I think, a really good lesson that I've learned from working directly with the seniors. And frankly, it fits my operating style as well, because I'm not a sales guy, nor are we a sales organization. And so it's helpful to be an educational organization. It's hopefully, if we do a good job at that, then, you know, the sales and the numbers will all take care of themselves.
Yeah. How do you train your staff to work with empathy and respect for aging clients?
Great. Well, the most important thing we found there is to be really particular and choosy in our hiring process. You know, because those are tough things to train for unless you've got a foundation of it somewhere in your life. So hopefully we've attracted the right staff to be able to have that capacity. And then we do a lot of formal training, and we do a lot of role playing, and then we do a lot of sharing during our team meetings. So all of those things reinforce kind of the opportunity to demonstrate what I mentioned previously. Listen really deeply, be genuinely respectful of them, and then educate. And that seems to be very well received by our clients. It also seems to be very well received and enjoyed by our staffs, because it's really rewarding to them to be given that opportunity and independence to be able to work with, collaborate with the end clients to come up with the perfect solutions for them, and then see the results of those solutions being implemented, and then get the satisfaction of really making a dramatic impact in the quality of their lives.
Nice. For folks that think they could just go on Google or even Yelp and just find any contractor, a handyman, for example, to install a grab bar or anything related to senior home modification, what makes home safety services different from hiring any contractor or handyman?
Well, a lot of things. Most importantly is probably the expertise and the knowledge. So, as I alluded to earlier, home modifications are not, a one-size-fits-all proposal. We have to assess the individual and assess the configuration of the home, as we talked about, to make sure that the appropriate solutions are provided. Calling up a handyman, calling up just a general contractor to come out and install some grab bars.
Yep.
They may or may not be competent to anchor something securely to the wall, but where they position it to be most effective and most helpful,
Right.
Is not assured by far. And frequently we get called out by clients who request us to put grab bars in kind of crazy places where they are used to grabbing for support.
Yeah.
And we have to patiently kind of educate them to say, well, the best practice is to have it oriented this way as you step over the threshold, and in this manner when you're getting up from the shower chair, and here's why. And generally they come around and go, yeah, that makes a lot more sense. And so, whereas a handyman coming in is probably just going to ask the client where they want it and zip it in place, and call it good. So there's lots of, we could do a whole podcast just on, why use a professional like us as opposed to a handyman or a general contractor.
Right. You offer that extra layer of wisdom of where things should be, right? Yeah.
Well,
really needs to happen.
absolutely.
Yeah.
Again, I can just go on and on and on because we do tons of installations,
Right.
still in the grab bar space, into fiberglass shower enclosures. Most handymen and general contractors are going to go, whoa,
Yeah.
I'm not drilling through fiberglass.
Yeah.
So,
They've never done it before. Yeah.
yeah, exactly. So suffice it to say, if folks have a need in this space, please, reach out to us, reach out to another professional that really focuses in this space. It's well worth it.
Nice. Now, let's talk about the future of home safety. What trends or innovations are you most excited about in senior safety?
Well, let's see. I guess trend-wise, I'm really excited about the increased consumer awareness, which is driving the increased funding for these things, as well as just improved products as well. So all of those things bode really well for the future. Years ago, we had very few aesthetic alternatives for home accessibility solutions in the marketplace. And through the years, now it's changing dramatically and will continue to change as these solutions improve not only their effectiveness, but improve in their not standing out in the home as a medical device and being more aesthetically pleasing and thereby more accepted by more clients. On the funding side, we're seeing increases in funding through more sources. There's definitely a movement towards what's called hospital at home, in addition to the aging in place movement. And both of those, in addition to the demographic surge of aging seniors, is really just going to create more and more need and more funding for these services to be done properly. Combination of those things is leading to more consumer awareness. And so more folks are going to, I think, more proactive than they have thus far. When I started the business, I really expected half of the clients to be proactive and planning for their decreasing mobility. What I found was that that's very much not the case. It's 90+% that are reactive. And so hopefully we can start to move the needle a little bit through greater consumer awareness that more folks will take a proactive approach to modifying their homes such that they're going to be able to live independently for as long as they wish.
Yeah. Now, speaking of taking a proactive approach, if someone wants to prepare now, what should they look for in a home modification partner?
In a home modification partner, such as a professional service.
Yeah. Yes.
So, credentials, as I mentioned, absolutely that they're a licensed general contractor, as many of the certifications as possible, and truly that the Joint Commission accreditation that is the key to really demonstrating your commitment to this space and a huge investment in making sure that everything about your service is appropriate and has safety of the client first and foremost. So really strong credentials, great references and great referrals, obviously, and reviews, but also a substantial base of business, history and portfolio. We are starting to see more and more new players pop into the market, and it's oftentimes challenging to differentiate, online between a quality player and a non-quality or unexperienced player. So yeah, I would just look for one that's as experienced as possible because, we've done 40,000 plus homes, and we're still learning.
Yeah.
So for folks that have done 40 homes, it's a whole different
Right.
category of service that you can provide.
Yeah. Just for my knowledge, are there any other Bay Area based companies that do what you do that have been around longer than you?
No, I don't believe so. So yeah, we again, when we started, there weren't other service providers
Yeah.
focused exclusively upon what we do. There, in other parts of the country, there are a handful that had been around, but we only learned of those as the years progressed.
Yeah.
So yeah, for Northern California at least, and pretty sure all of California, we were really the first or one of the very first.
You guys are pioneers at the time. Yeah.
Yeah, we really were. And that was part of our vision. Thanks for mentioning that. That we established way back when. It actually uses the word pioneer in it to say be a pioneer in the field of home accessibility and home modification. And looking back, we really have been, and it's really rewarding now to be nationally recognized as really one of the leading companies in the country that's focused on this space.
Yeah. What's been the most meaningful project you've ever worked on?
Let's see. Well, one that comes to mind there is another ramp project, ironically. And when we talk about ramps, these are modular systems that we're able to usually put together quite quickly to create a safe access for individuals coming in and out of the home. So this particular case was really a tragic case where a doctor in the East Bay was a cyclist, got hit by a car, became a quadriplegic, lived in a very nice 2-story home on a hillside.
Mm-hmm.
But just tragic. He was now a quad and had no way first to get home because of the multi-story access. We got a call from the wife, and she'd already had 3 or 4 other providers come out to try to create a solution for her, and none were able to do so.
No.
Just the nature of the elevation change, the tightness of the spaces. Her one alternative that she had was to remodel the front of the home to be able to accommodate a full-blown elevator to go from ground floor to second floor. And the cost was going to be exorbitant. But she called us in. We confirmed everything else that the other providers had confirmed in terms of lack of other alternatives. But we scoped out the hillside adjacent to her home and were able to design a ramp system that we were able to overlay over this cascading hillside up to a back deck and then into his master bedroom through the back deck. And love to show a picture one of these days. A wonderfully contorted ramp, scaling this hillside, but once installed, super secure and provided him wheelchair, initially gurney access, all the way up to his home and all the way back down. And we were able to do so, I think it was within 2 weeks, in time for when he was ready for discharge. And so it was wonderfully rewarding, a fraction of the cost of doing the major remodel work for the elevator that would have been required. Wonderfully appreciated again by the family. And it enabled him to stay in that home for a couple of years. And ultimately, the family decided to relocate. And when they did so, we came out and removed the ramp structure and made the hillside appear like it had never been there. And so they were able to then sell the property without a cumbersome wheelchair access modification that not every buyer may have appreciated. So, yeah, so that one really sticks out as super rewarding. And again, because she had solicited and gotten feedback and input from multiple parties before bringing us in. And so it was really our unique knowledge and I think passion that helped her get a solution that worked out well for her.
Yeah, I mean, and I'm sure the years of experience help. I mean, you guys, right here in this example, you guys are creative solutionists that saved this person money at the same time too.
Yeah.
It's amazing. What keeps you personally motivated in this work?
It's a great question, but it's just like that last story. Fortunately, we are getting feedback from our team on literally a daily basis. You know, how'd you help somebody today?
Yeah.
How did it go today? And so, so I'm not out in the field. It's our team of technicians that's out there having those engagements. But truly, as they come through the office, I'm picking their brains as to how it went and what the challenges were. And so I get a sense of their satisfaction that they've achieved. So kind of a vicarious participation on my part at this point. But it's also the direct feedback that our clients will give us, whether it's an online review, picking up the phone to talk about their experience. And so it really has proven to be wonderfully rewarding from, again, not just building a viable business, but how tangibly we're helping folks and how the vast majority of our clients really, really appreciate what we do for them.
Excellent. What's something most people don't know about running a senior home modification business?
I hope it's a bit of everything that we've talked about thus far. It's the product knowledge, solution knowledge, construction knowledge, bedside manner, medical knowledge, patient safety, hygiene, importance of hygiene knowledge.
Yeah.
So just full spectrum. So I'm sorry, it's not the best answer, but hopefully there's a lot. Hopefully we have some barriers to entry, but that's all I got for you.
All good. And one of my last questions is, if a family is overwhelmed and doesn't know where to start, what's your best piece of advice?
Well, just to request and schedule a home assessment. So, and we can do those in person, again, for whether it's with us or with, another provider, obviously.
Yeah.
But to have that home assessment done, we do them in person, we can do them virtually, if that's easier. And oftentimes, adult children are spread around the country. A virtual assessment is super helpful to them.
Right.
So, and that is super educational to them because we can share a ton of information as to what the priorities are and how big the challenges are. And oftentimes it's far less daunting after we've had that conversation because generally we can make some very practical modifications that will make a big impact in how their loved one is able to access and perform independently at home.
Yeah. And finally, Martin, last question. How can people reach you or your company or learn more about all your services?
Great. Well, thanks so much for asking, Dale. So our company name is Home Safety Services.
Okay.
And we're based here in Burlingame, California. Our website is www.homesafety.net, just homesafety.net. And the easiest phone number for us is our local one, 650-571-7774. Again, we serve virtually all of California. Happy to take your call. Happy to talk you through our services over the phone. There's no charge for on-phone consultations or for virtual assessments. And so we really welcome folks to give us a call, and we'll be happy to share as much information with them as we can. To be really transparent about how our services and how our fees work, because we really strive to have there be no surprises in terms of having an engagement with folks. So we welcome all callers in that regard.
Excellent. Martin, thank you so much for joining me today. Your 20 plus years of experience, passion for safety, and dedication to dignified aging are inspiring. And what you've shared today is going to help so many families feel more confident and proactive about creating a safer home for their loved ones. And for those of you watching or listening, if your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation with me by clicking on the Calendly link in the video description box. Learn more about my services at www.simplifyseniortransitions.com. Have a quick question, DM me on Instagram at SoldByDale. And if you found this episode helpful, please leave a 5-star review on Apple Podcasts or Spotify. It helps more families discover the show. And don't forget to share this episode with someone who might need it. Thanks for tuning in. One last thanks to Martin. Thanks again for being on the show.
Oh, my pleasure. I enjoyed it a lot. Thanks, Dale.
You're welcome. And for everyone else, I'll see you on the next episode of the Simplify Senior Transitions podcast.